was held previously. It is mostly unchanged, except in some small parts. What I will tell you before we start is first, this webinar is about blood tests, but I have not included any numbers for blood tests because each lab and each hospital in different countries have different values and referrals. So if I will present you one number, you might have a different one in your country or in your lab, so you might get confused. And usually labs have their own referrals, so you can see the number higher or lower for a particular blood test. Also, I will not be retelling everything that the slide has. I will just, except for the most important information, I will just tell you the most important parts. Okay, if everyone can hear me well and see the screen, I will start. So did the slide move? Because I'm not sure you receive it on your end.
Yes, we have received it.
Okay, so what is blood? So in humans, blood is bodily fluid. Its function is to provide nutrition and oxygen to our cells, our body, and it consists of two main parts. So the first part is blood cells. Human blood has three principal blood cell types. It's red blood cells, white blood cells, and platelets. And the second part is blood plasma. It has fluid, mostly 92% of it is fluid, and it has all the other stuff except our blood cells. For example, nutrients, which are glucose, fatty acids, proteins, ions, electrolytes, hormones, and etc. It also has carbon dioxide, which is removed from our cells when we breathe. So the principal parts we're going to talk about are all of these, and we will move to talk about more about this function of blood. So the first function of blood is to supply oxygen to tissues. Oxygen is bound to hemoglobin, which is carried in red blood cells. It supplies nutrients. So the main nutrient that our blood supplies is glucose. It's in other words, sugar, amino acids from proteins we eat, and fatty acids from food. These are all used for our energy needs or to build up our body. It also removes waste from our cells, such as carbon dioxide, urea, lactic acids, which are produced when our cells function. One of the most important functions that we're going to talk about today is immune function. It is carried out by white blood cells, also named leukocytes, and it also has in its plasma antibodies. We will also talk about them later in this presentation. So another important function is coagulation. It's blood's response to a broken blood vessel when you suffer a contusion on your body or lacerate yourself. Our blood detects this breach in our vessel and forms a special clot that looks like a gel, and it closes up the broken vessel and prevents us from bleeding. It functions as a messenger also. It transports hormones and other biologically active substances to carry different signals to our body. It regulates body temperature, and it has hydraulic functions, mechanical functions to anti-shock and so on. So we will talk about blood tests today, and blood tests are prescribed by doctors to help us understand how the patient's body works. So they evaluate how well organs function, for example, kidneys, liver, thyroid, and others. We can, using blood tests, we also can diagnose different diseases, especially infections, also cancers and so on. Find out whether you have risk factors for some kind of disease, for example, heart diseases or cancers. To check whether medicines we have prescribed are working and whether they are working the way we are expecting them to work, or if they cause any side effects, and assess how well the blood is clotting. So probably most of adult people in their life have had one or the other blood test performed. So usually when a doctor prescribes blood test, he or she tells you that how to prepare for it. For example, not to eat before a blood test, or to eat something, drink fluids or not. This will be talked about by your doctor. He will tell you how to do this. So when you usually come to a lab, you to have your blood drawn, there are a few ways we can use. We can take your blood, for example, a prick test, when you just prick your finger and take some blood from it for analysis, or a more invasive one, vein puncture, when we take some blood from your arm. So safety and security will be during this procedure will be held by lab workers. So they will tell you to wear a mask. They will see so that everything is sterile and so on, and they will guide you through the procedure. So I will not talk about this about that here. So you should know that when you come to a lab, you will be told how to what to expect and how to behave yourself. So that's should not be a problem. So the most common blood test types are complete blood count, blood chemistry tests, blood enzyme tests, and serology tests. Complete blood count is a test that determines the composition of your blood in cells. So as we talked before, blood consists of two parts, cells and plasma, and this one responds to all the cells that you have in your blood. We will not talk about all of the cells because they are not particularly touching the infection theme we're discussing today, but there's a lot to talk about in cells. It can, even one cell type can take a whole presentation. So today we will be talking mostly about white blood cells, but for your information, complete blood count also includes red blood cells, so we can determine whether there is enough red blood cells to carry oxygen, and platelets. Platelets are important in the fact that they regulate blood clotting, so they're also very important. So in aspect of immunity, we're going to talk about white blood cell differential. It's a test that used to measure the ratio of white blood cells in his blood. So the main white blood cells are neutrophils, lymphocytes, monocytes, eosinophils, and basophils. So there are a few slides ahead that have more details in them, but I will walk through them briefly and just tell what cells corresponds to what, and we will move on. So neutrophils are the most common white blood cells. They respond to bacterial immunity. So when there is a bacterial infection, you will have increased white blood cells in your body. White blood cells can also decrease in some conditions, especially cancers, some drug treatments, chemotherapy, and during immune suppression and so on. So they usually increase when you have bacterial infection and usually decrease when we have some sort of severe underlying illness which causes our immunity to be suppressed. So the second most important white blood cells are lymphocytes. They are usually elevated when we have some kind of a viral infection. And it's important to note that COVID-19 is also a viral infection, and sometimes they can increase during this infection. Usually, if the infection is not severe, lymphocytes do not increase very much. They usually increase during herpes virus infections, such as infectious mononucleosis. And it's important to know that sometimes when you have infectious mononucleosis, you can develop atypical lymphocytes. They will be determined by the lab workers, and you might see them in your blood test. So it does not usually signal something you have to worry too much about. So if you have them, just talk to your doctor, and it's probably something like that. The third most common type is monocyte. High monocyte counts are usually caused by some kind of chronic infection, and lower amounts are seen in immune suppression. Eosinophils and basophils are the rarest types. They usually correspond to if a person has some sort of allergic reaction, they usually can increase. Also, tapeworm infections, parasitic infections can also increase them. So everything being said about white blood cells is that they usually increase with infections, either neutrophils or lymphocytes. Also, it is important to note that in children and in adults, there is a different ratio. So, for example, in adults, we have more neutrophils and less lymphocytes, and in children, we have the opposite situation. We have more lymphocytes and less neutrophils. So in COVID-19, they are usually changed when there is a severe infection. Severe infection meaning that a person is in a hospital and receives intensive care, like oxygen support, continuous infusion of drugs through his veins, and so on. So when there is severe infection in COVID-19, all of the white blood cell types can be decreased. So they are usually decreased in severe infection. And in mild cases, you might expect your blood test to be almost normal. The most abnormal test we'll discuss next about the blood cells. So the test that will be abnormal during the COVID-19 infection is erythrocyte sedimentation rate, ESR or SID rate. It's an older type of test, but it is very robust, and it can tell the physician whether there is an inflammation in your blood. Not only COVID-19, but all kinds of infections and some other conditions can be discovered by the erythrocyte sedimentation rate test. So usually, when you don't have any inflammation, the test is normal within the ranges that are referred by lab. And during infection, the sedimentation rate is increased. So in patients with COVID-19, as with other infections, the ESR is increased. Also, it is important to note that male and females men and women have different rates. For example, males have a lower sedimentation rate, and females, especially during periods, have increased erythrocyte sedimentation rate. So that might also be present during your blood test. So the next important blood test I want to talk about are blood clotting tests. As I've talked before, blood functions as has a blood clotting function to prevent bleeding. And one of the most important tests in this regard is the dimer test. So when a blood clot forms to prevent bleeding, it is usually not there forever. So there is a damage in your vessel, a clot forms, it prevents the bleeding, while it stays there while the vessel is repaired. And after the blood clot falls down, it has components degraded by special enzymes in our body. And one of these components is D-dimer. So it tells us that there is an increased blood clot formation in your blood, and it helps physicians to understand. For example, if you have some kind of chronic condition or other risk factor, to prescribe some kind of anti-clotting medication. So there is a lot of information about the dimer being elevated in COVID-19 patients, but it is important to notice that usually in outpatient setting, meaning you have mild COVID symptoms, you are not in the hospital, and you do not have any risk factors for increased coagulation, increased blood clotting. So usually, even if this test is increased, it does not mean that you need to take antiplatelet medication, because, for example, in Ukraine, some physicians often prescribed anticoagulant medicines like blood thinners, you may know them. So sometimes physicians prescribe them even in mild cases in young people who have no predisposing factors to increased blood clotting. It's also important to note that we are afraid of blood clotting because it can cause, for example, stroke or a heart attack. But this is also accompanied by risk factors. For example, you have chronic arrhythmia, you have hypertension, or you have increased fatty acids in your blood. So in these cases, your physician might consider giving you anti-clotting medication. But usually people with these risk factors are already taking low-dose aspirin or clopidogrel, antiplatelet medication. And sometimes physician prescribes in addition to these, or prescribed antiplatelet medication in healthy patients. Sometimes they prescribe both antiplatelets or anticoagulants, and it's important to ask the physician why this is being prescribed, because usually the benefits outweigh the risks, but sometimes when the prescription is not supported by enough information, for example, in COVID-19, it's in mild cases when the patient is not hospitalized, there is not enough information that benefits outweigh the risk of prescribing antiplatelet medication. And they also have a serious side effect, that is excessive bleeding. It means that your blood is not able to form clots and to stop the bleeding. And we will talk about excessive bleeding in this aspect. So signs of excessive bleeding is when you pass blood in your pee, when you pass blood when you poo or have a black poo. If you have bruises you don't know where you got, like or you have severe bruises. If you have prolonged nosebleeds, like lasting longer than 10 minutes, if you have bleeding gums, if you cough up or vomit blood, you have severe sudden back pain, which irradiate to your stomach. If you have difficulty breathing or chest pain, or if you're a woman and you have excessive bleeding during periods, you need to contact your GP, the physician that prescribed you, or go to emergency department right away. Also, it is important to note that when you are taking blood thinning medications, and you are involved in an accident like a car crash, you experience significant blow to head, or you are not able to stop the bleeding you have, you need to go to the emergency department. So these are obligatory. Just if you value your health, you need to do this. Also, one kind of blood thinning medication called warfarin. If you're taking this, you need to do regular blood checks through a special blood test. There, especially for patients in Ukraine, I know that our patients sometimes ignore this prescription. If you're taking warfarin, you're absolutely required to have a test to check if it's working correctly every month. So it's very important. Bleeding is especially hidden bleeding, is very, very dangerous. So the next blood test is blood chemistry test, and they usually tell us two things. So first thing is whether your organs function properly. For example, in COVID-19, we can have liver damage, kidney damage, and they are indicated by, for example, serum urea, creatinine, bilirubin, liver enzymes, and liver tests. And if we have abnormal values for that, we can see that some organ is damaged. Also, it is important to notice that especially in patients with COVID-19 or with patients with infectious diarrhea, when you have like you have to go to the toilet, like you have a diarrhea, especially severe diarrhea, you can have abnormal electrolytes, and uncontrolled diarrhea is as dangerous as bleeding. So if you have loose stools and you are losing a lot of water and you are unable to rehydrate, you also need to contact the physician or call to emergency department. So also very important. C-reactive protein you might see in your prescription is a special protein. It's same as erythrocyte sedimentation rate. It tells us that you have an inflammation. So it's just a test to show us that you have an inflammation, to be short. The procalcitonin is also one of types of tests you can see in your prescription. It is also indicative of an infection, but a special kind of infection. So during COVID-19, especially COVID-19 pneumonia, you can receive this prescription for this test, and it is for physician to understand whether you have a bacterial pneumonia, because it is usually increased during bacterial infection, or if you have severe COVID-19 pneumonia, we can determine whether there is a underlying additional bacterial infection. So for example, sepsis and generalized infection causes procalcitonin to be increased. So this is also an important test, and your physician will know why he orders it. So usually during bacterial infections, it will be increased, or bacterial infections or severe viral infections with, especially with addition of bacterial infection. So blood glucose test is also one of the most basic and important tests, and it is used to measure your blood glucose level. So sometimes, especially if you have a relative or you're yourself a diabetic, you might have your own blood sugar monitor, which uses express testing to measure your blood glucose, for example, after you eat or something. Or a physician can prescribe your blood glucose test if he has some sort of suspicion towards your health. So Usually, blood glucose test is increased during infection. Blood glucose level is increased during infection. So do not be alarmed if you have increased blood glucose, even when fasting, when you have some kind of infection. It just means that your body produces certain hormones that increase your blood glucose to help itself fight this kind of infection. But usually, if you have if you're in good health and you have increased blood glucose, especially during fasting, it means that you have some sort of glucose intolerance, and you should contact your physician right away. Serology, it's an important part of today's discussion because a serologic test determine the immune response or presence of parts of infectious agents in our blood. So usually it determines if you have either antibodies or antigens in your blood. And in COVID-19, we have rapid antigen tests, which are not done by blood. Rapid antigen tests are done same as polymerase chain reaction tests. They are taken by having nasal or throat swabs. But it is also important to mention those. And in contrast to them, serology tests, especially in COVID-19 cases, determine antibodies for certain virus or a bacteria. So as a virus, COVID-19 has causes our body to produce antibodies, and an antibody is like keto lock. So imagine COVID-19 as a lock and our antibody as a key to this lock. So when virus enters our body, we recognize it, but with the help of antibodies. And in response to virus replicating, we also replicate more antibodies to help us fight this virus. And our antibodies tell us how to fight and where. So if you have a virus in your body, it means you will have antibodies to that virus also in your body. So as viral replication increases, also our immune response, our production of antibodies increase, and they tell us that you have a virus. So physicians already know what kind of antibody increases during COVID-19, and we know when to use the antibody tests. So antibody test is different than PCR and rapid antigen test because in COVID-19, usually there is virus in your body already even before you get sick. So before you develop symptoms, there is already a virus replicating within your body, and it can be determined even a few days before the onset of your symptoms. For example, you have been at a party somewhere, someone at that party had COVID-19. You have contacted that person, he passed COVID-19 on to you, and in a few days you are developing signs and symptoms of COVID-19. But before that, usually around 2 days before that, there is already a virus in your blood. So in people that have COVID-19 contact, we recommend self-isolation even if you have contacted someone who has developed symptoms during the last 2 days. So if you have confirmed contact with someone even before he has symptoms during the last 2 days, you need to self-isolate. So we'll return into our tests. So in contrast to PCR test, antibodies start developing, as you can see on this slide, at the end of the first week. So we use immunoglobulin M or antibodies to determine if there is an acute infection, and antibody G, immunoglobulin G, to determine if there is infection has passed. So as you can see on this chart, antibodies start developing at the end of the first week. They peak around week 3 or 4 and start declining after week 5 or 6. So what does this mean for a physician? So to diagnose COVID-19 infection, if we have choices such as polymerase chain reaction testing, PCR test, or rapid antigen test, we will use those. Because when you have symptoms, it is more likely that you will have positive PCR or a rapid antigen test positive than you would have an antibody test positive. So this means that antibodies are present when you are already having signs and symptoms for more than a week, or even after you have recovered. And what this means is, in short, physicians do not prescribe antibody tests to determine whether you have acute COVID-19 infection. Also, it is important to know that there is not enough information nowadays to know whether these kind of antibodies will prevent future infection. So mostly nowadays, what can antibody tests tell us about? So it can, if antibodies are increased when we do the test, it means that you have probably had COVID-19 infection in the past. It also does not mean that you are immune to this infection. So this is why physicians usually do not prescribe, because it provides us with very little information besides the fact that you have had COVID-19, and that's it. So something like that. Also, another kind of test is a pulse oximeter test. It is not a blood test per se, it's more like a blood scan. So we have a device called pulse oximeter. It has a special light that scans, for lack of a better word, through your tissues, through your red blood cells, and it determines the oxygen saturation level. It means how well your blood is supplied with oxygen. And usually the normal range is more than 95%. So if you have a pulse oximeter at home and it shows more than 95, it means that you are okay. If you have some kind of a chronic lung infection, for example, sorry, not infection condition, for example, bronchial asthma, chronic obstructive pulmonary disease, or some other kind of chronic lung disease, you might have lower numbers. So in these cases, your blood saturation level normally can be as low as 92%. But if you are healthy and you do not have these kind of conditions, usually less than 95 is cause to contact your healthcare provider, for example, to call the float hotline. It's also important that COVID-19 has a kind of silent hypoxia. It means that you feel okay, you do not feel shortness of breath, but your oxygen saturation level is lower than normal. And for that, we also need a pulse oximeter. So if you have a positive or suspected COVID case, you might need a pulse oximeter. And it's important to note that the Float project distributes the home monitoring kit that have this kind of device to help you manage COVID-19 symptoms. So Any questions? Don't mind this cat. While this presentation is going, for around 20 minutes more, we can discuss any questions you have in regards to blood test. I know that some patients have a lot of questions, especially in regards to antigen tests. So if you want a presentation in Ukrainian language, I will try to find the link and post it here. So any questions? Yes, Katerina.
Thank you, Dr. Andrii, for very informative presentation. I have just a small question regarding blood tests. Is there any indicator that could tell me that I am prone to have more complex COVID-19 infection than, for example, other people, or it's a myth? Thank you.
Yes, thank you. I didn't cover it in the presentation. So in people with decreased white blood cells, so when we determine the white blood cell differential, if we have lower amounts than usual of these immune cells, neutrophils, lymphocytes, monocytes, it usually signals that there is some kind of immune suppression. And even when there is normal amounts of these blood cells, but you are prone to different kind of infections, especially in conditions such as HIV or other, for example, genetic or other sources of immune suppression, also in chemotherapy. In short, if you have any kind of immune suppression, you might have more pronounced infection of COVID-19 and all other infection. So your physician usually will tell you that you have a risk factor for more severe illness. So you also need to be aware of that.
Thank you, Dr. Andrii. It's clear to me.
Thank you. Any other questions? Okay, so no one wants to ask some questions.
Can I have a quick question? Sorry.
Yes,
Hello.
thank you.
My
Yes.
name is Maria. The question is, so I've heard that this pulse oximeter, sometimes it shows something like, let's say 95 on one finger, but on the other finger it can be lower. And actually it is very unstable indicator. What do you think about that?
Mm-hmm. Thank you. Also, important question. So, pulse oximeter usually shows numbers when your finger is warm. It's very important to note, and it does not have any kind of obstruction on its surface. For example, if you have nail jobs on your fingers, different kinds of coverings, pulse oximeter might show abnormal or no numbers at all. So you need to have your finger clean, warm, and then it will show the number. If you have some kind of nail conditions, it might also show abnormal number. So usually if you have different values of different readings of pulse oximeter on different fingers, it means that you have something on your finger that prevents it from scanning your blood correctly. Pulse oximeter can be used on not only on fingers. Sometimes people place it on one's ear, especially when there is trouble with circulation in fingers. So, but usually it is used on fingers. So it will provide the reading. Usually, if you have trouble having reading on pulse oximeter, you should also contact your physician, and he will help you sort this out. He or she.
Thank
Yes.
you. Okay, thank you.
Thank you. If you have if you don't have any questions now, you can always call the flood hotline, and we will help you with any question in the medical field. That is. So I will post in this conversation of this chat the our contact information, and I will post the this presentation. If anyone wants the Ukrainian version, I will also try to find it. Yes, Katerina has posted the link for our hotline here. Thank you.
Apologies, can we have that distributed in the email exchange? Because I don't really have the access to chat right now.
Email, you mean the link to flood hotline?
Yes, whatever you sent to the chat, I would be really grateful to receive that via email.
Okay, well, I will try to sort that out.
Okay, let me quickly add a few words regarding the distribution of the recording of this presentation. It's sometimes more complex to obtain the recording via direct link, so we will most probably post the recording on YouTube and will distribute the link. In case you will not receive it due to some kind of issue, technical issue, please do not hesitate to contact our FLOD email or email of Dr. Andrii that you can find in the email, or my email. My name is Dr. Katerina Kemin, and we will help you out. Thank you once again for your attention, and thank you, Dr. Andrii, for really very informative presentation.
Okay, thank you. Stay safe, everyone. Have a nice dinner if you didn't have yet. Okay. Stay safe, stay healthy, and goodbye.
Wish you everyone a happy, nice weekend and safe weekend. Thank you.
That is
Yeah.
also. Yeah, thank you.
Yes. And weekend is where we need to be very much careful during the weekend, right?
Yeah.
As this is the time when we go here and there and forget the mask and forget our to take our the small bottle of the right. Okay, thank you,
Okay.
Andrei. Yeah, I was listening and keeping quiet actually. As
Thank you.
it's really nice presentation, and thank you very much. And appreciate colleagues for joining also. Thank you.
Thank you very much. Okay. See you all.
Bye bye.